Respiratory therapy, Lesson 3, Circuit configuration of the ventilator. This unit will cover the basics of respiratory therapy. The goal for this lesson is to understand the circuit configuration of a ventilator, and learn about the functions of each component of the ventilator. This is the content of this lesson. This is the basic circuit configuration of a ventilator. The ventilator basically works by connecting the power supply, oxygen and air pipelines. The configuration described here is the one with the heated humidifier. In the case of using an artificial nose, the artificial nose is attached to the end of the Y-piece connector. Using the heated humidifier and artificial nose simultaneously is prohibited due to the risk of clogging the artificial nose. Let's go over each of the components in detail. An inspiratory filter is designed to prevent the passage of dust and other fine particle matters that may be contained in the air emitted from the ventilator. After passing the filter, the air goes into a heated humidifier. The role of the heated humidifier is to maintain the humidity by heating the air to the same level as the body temperature, in order to prevent the airway injury and other harmful effects due to the dry air coming through the pipeline. The air leaving the heated humidifier goes through the inspiratory limb to the Y-piece connector. The inspiratory limb contains a heater wire to keep the heated air warm and prevent the air temperature from dropping by outside air temperature. After ventilating the patient through the Y-piece, the exhaled air from the patient returns to the ventilator through the expiratory limb of the breathing circuit. Since the exhaled air from the patient is heated and humidified, condensation tends to accumulate in the circuit, so a water trap is placed in the circuit or a heater wire is used like the inspiratory limb to remove the moisture. Before the exhaled air returns to the ventilator, the air goes through an expiratory filter placed at the end of the expiratory limb. An expiratory filter prevents the moisture-laden exhaled air from entering the ventilator, and also serves as a bacteria remover to prevent the patient's exhaled air from being discharged into the room. This is the end of Lesson 3, Circuit configuration of the ventilator. Make sure you've mastered the basic concepts before you move on to the next level.